represent an organization which is based in a very remote part of Nagaland. One of our primary work has been on health in some of India's poorest tribal belts. The Planning Commission of India had a set of 150 most backward villages, districts, and in all of these districts, in 5 of the villages where ECS has been working, we have been working primarily among tribals. One of the things that we have seen in this region has been the total lack of infrastructure and failure by manpower to deliver services. So, despite the fact that NGOs or communities have been creating awareness, it has not been compensated with infrastructure, compensated with adequate manpower so that primary health is addressed. So this has been one of the issues, and the region being so remote, I find that remoteness is also another challenge, because when it comes to health, I think the primary issue here is again accessibility. And so we work in around 40 blocks, which has a cluster of around 84 villages, and in around 7 to 8 primary health centers, where our primary focus has been to make these government primary health centers functional. And in that way, we found that when communities have a greater sense of ownership, then we found that people began the need for health. And when there was this need for health, then there was also a greater response from the service providers. So this has been one of the approaches of the organization. I think the government policy should design something very different for tribal areas. And especially when I say tribal areas which are remote, hard to reach, and difficult areas where there is greater partnership of the government with the community. And I think that's one of the areas I feel where the government has to seriously address and design policies and have programs which are not part of the national policy, but specifically tailored to address and make it inclusive in the whole planning process, where the tribals themselves becomes the primary stakeholders, so that they assert their right to health and to life. And so I think that's really the way forward, to as much communitize these health services as much as education and in terms of the other programs. And so there has to be a very different approach to how we design programs for tribal areas.